Hey guys, and welcome to my channel. My name is Becky. I am a mom of 3, an avid cook, and I've been married for 5 years. Today I am going to talk to you about home birth versus hospital birth. Today I am actually 3 months postpartum. I don't know when this video is going to get posted, but that's what I am today. I just had my third. She is a girl, our first girl. The first 2 were boys. The first 2 boys, I definitely had hospital births, and I was given epidurals for both of them, pain medications, all that stuff. And this time I opted for a home birth in water, and it was amazing. I had a certified midwife with me the whole time. So this is going to go over the pros and cons of both. Obviously, all this is based on personal experience, of which people have many different experiences, and that's totally great. I'm very okay with that. But my goal for this video is to give you unbiased and helpful advice about both. If that's why you're here, that is why we're creating this video. So feel free to listen in, and I'm excited to tell you. As always, I would love to hear about your experiences and if you have any comments about these videos. So please drop them below, and don't forget to like and subscribe. Okay, so we're going to talk about the pros now of a hospital birth. So first, there's going to be no mess in your own home. So there's no cleaning up, there's no, prepping things in your house for a birth, like blowing up a birth pool or, washing your towels afterwards, anything like that. And then you always have immediate access to medical emergency care. So let's say you need a C-section, then you're there right away, and so you can get a C-section, or you need a blood transfusion or anything like that. Birth is crazy and a lot can happen, so it is nice to have that immediate medical access. I'm grateful that I was never in need of any of that. However, if I was, for this one, we were 4 minutes away from the hospital doing a home birth, which is really helpful. Hospitals also take all insurances, and that's very difficult with a midwife because it very much depends on the state and what they are qualified as a medical professional. And in several states, midwives with a midwife master's degree after they get their nursing degree is not considered a professional birth doctor, I guess. I don't know the terminology in the bill. I read it. I don't remember, guys. But they aren't covered by insurance. So it can be a lot out of pocket to think about, and none of it goes towards your deductible for any other things that happen within the year. But also, another pro is that kids get to stay in their own home. If you don't want your kid at your birth, which is totally understandable, again, your choice. I didn't have my kids at any of my birth, but also they're very young and I just wasn't ready for that. And I know some people are just really, really open about that, and they do want their kids to experience it. But you can keep your kids at home. You can have, grandma and grandpa come over and watch them at their own house. And that always tends to go better in the transition of introducing a new child into your house. The other thing with a hospital birth is you can get prenatal ultrasounds very, very regularly. Okay, now we're going to go into the pros of a home birth, and I had a certified midwife with me, but I think these apply to most home births. So the first one is that appointments are at home and they last about 45 minutes versus your 15-minute hospital appointment. And they talk about physical, mental, and emotional needs within all of the context of giving birth and being pregnant, all of those things. I found it super helpful just because I felt really dismissed in a lot of my hospital appointments, especially 30 weeks to 40 weeks when you are really emotional. So that was helpful for me. And then also there's no beeping machines while you're giving birth and no needles when you're giving birth at home, obviously. And then also you sleep way better when you're at home because you don't have someone coming to wake you up every 2 hours to make sure you're feeding or to press on your stomach or any of those things. Of course, it's important that you're healing correctly, but it is also really nice to get a good night of sleep after giving birth. You're super exhausted. And then also, you're allowed to sleep with your baby in your own house, obviously safely. I wouldn't recommend, falling asleep in an armchair with your baby. Obviously, that's way not recommended. But if you have a safe space for your baby to be next to you in bed, whether that's a bed bassinet that lays next to you, or something along those lines. Obviously, there's a ton of different things out there. It is really helpful because then you don't have to stand up after giving birth and you can rest your body for that time. Also, smelling your baby's hormones or endorphins or whatever they're called really helps your breast milk come in, and so it's helpful to just keep your baby by you. I would highly recommend it. It was super nice. Midwifery provides an open-minded view of the healthcare system, and so they're going to help you in ways and recommend things that a doctor wouldn't. For example, my baby was stuck, my third baby was stuck in my pelvis, and so they recommended chiropractic care, which was really helpful because we did end up getting the baby unstuck, and then I gave birth 4 hours later, versus if we had been in a hospital setting, that probably would have ended up in a C-section. But they also recommend things like physical therapy, homeopathic remedies for going into labor, or just to reduce swelling, one of my favorites, was drinking dandelion tea to reduce pregnancy swelling. And honestly, I feel like it did an amazing job because I was very swollen with my first 2 kids, and I don't feel like my face was swollen at all with this kid, so that was great. Also, home birth allows you to birth in your own microbiome. And that sounds like really scientific, but basically what it means is within the first 24 hours of your baby's life, they aren't going to be exposed to like the harsh cleaning chemicals in a hospital. They aren't going to be exposed to any of the germs within a hospital. You guys would be really surprised about how many different babies will catch things from a hospital that they're born in. And it's just because hospitals are like that. The other thing that I really felt was a pro for home birth was feeling like yourself while you're giving birth versus feeling like a patient and something on somebody's to-do list. I don't know what it was about the nurses that I experienced, and I love nurses, okay? I am a huge nurse advocate, but the nurses in my situation, it just kind of felt like they were trying to rush me into progressing, and then from progressing to like giving birth and pushing right away. And they just wanted me to get out of the birthing suite so that I could transfer over to mom baby. And I know that is not everybody's experience. And honestly, I have a lot of friends that are nurses in that situation, and I love them to death. They weren't my nurses, but I hope somebody can relate in that way. Another pro for me was there was no IV fluids given to me while I was, in labor or even like induced. I was induced with my second. And you can say no to that in the hospital. Know that you'll have to say no more than once, and they will be like, hey, but if we don't give you an IV in your hand, then if there's an emergency, we're gonna have to do one to a huge port so that we can get lots of access, or whatever that means. But what it really helped with was to not get engorged, so that nursing after they were born was a lot easier. I didn't get as sore, and it just went a lot smoother. I know that won't be the case for anybody, but it really, really helped me because I knew I had an experience with engorgement, which caused latching to not go well at all because everything was too big, and babies are so little. And so that was huge for me to not get IV fluids. And then also there are very few internal exams, we'll call them, because I'm not sure you too, but let me use the technical term for that one. So a midwife is not going to require you to have any, and also a hospital will. So there's that. They say that you can say no to them, but you're going to be saying no a lot of times. And then the other thing is you can eat at home. And so I was really able to keep my protein up while I was in labor, which really helped my energy level and really helped my blood and all of this different stuff. Like, you lose a lot of blood, so it's really important to build your blood up. It's obviously not like you eat food and then you have high blood again, like that. It doesn't work like that. But also keeping your iron up, keeping your energy up, keeping your protein up, keeping your healthy fats up, guys. Keep that up, because I know you feel swollen, but as soon as you start nursing, your baby's going to take on all those healthy fats. And so it is really important that you do that so you don't lose weight as quickly as society tells you you need to. So those are my pros for home birth. I'm going to go into the cons for both now, but I'm glad you have made it this far. Okay, so cons of hospital birth is what we're going to do first. So first, they're going to push you to make progress in your experience of giving birth, whether that's asking if you want Pitocin or making you get up and walk. I'm pretty anti going for a walk. Okay, going for long walks or like bumpy walks at 40 weeks pregnant, because if you walk for 2 miles, you're going to lose the energy to like push out your baby, and you really should have the most amount of energy. And so there are other ways to get your baby out besides going on a walk, just so everybody knows. I know that's a thing, but there are other ways you can get your baby out. Also, you can't pick your staff. And so that was really something that was challenging for me in my second birth. I had a nurse that was laughing about postpartum depression, and that was challenging for me. And so there was all of that. And then on top of it, she pulled out my IV incorrectly and broke the needle into my arm. And so then there was blood shooting everywhere, and that might be TMI, but it just was a whole experience. I kicked her off my case, and then they ended up putting her back on because they were short-staffed. And it just brought me a ton of anxiety right after giving birth. And then she also messed up at the end, and I ended up passing out on the floor. And yeah, it was just a lot of events. And so just know that you can't pick your staff even if you want to. And so there's a couple things that are just like less likely to happen in a hospital, one of which is respecting your birth plan. I know a lot of people go into it like, this is exactly how I want to give birth, in water and without drugs and all these different things. And they will see that and they will say, this is a great plan, I'm going to help you. And then once you're 6 centimeters in the transition period, they're like, well, we could offer all these things. And, we're in a decision-making point in which relieving the pain might be a better choice for you. However, maybe you didn't want that, you know? So that's something that is less likely at a hospital. Also, it's a lot less likely to be able to catch your own baby at a hospital. And that sounds like really weird, and maybe it isn't something you've thought about, but in a home birth situation, they always ask, like, it's not like the baby shoots out of you, you know? So it's something that's beautiful and that can be done, and it's less likely because you're gonna have an OB there that wants to check on all of the baby's vitals. And of course you can ask, like, totally advocate for yourself, you guys. But that is something that's gonna be less likely at a hospital birth. Also, this is really weird. I think that hospitals should change this, but there's no fridge in the mom baby room. So if you pump and you have colostrum coming out, you don't have anywhere to store it unless you brought an ice pack, which probably most people didn't think of, or it's melted by the time that you're already in mom baby. So there's that. It's just a weird thing. C-sections are also just more common within the hospital setting, and that's not to say a C-section isn't beautiful and isn't what was meant to happen, but if that's something you're trying to avoid, then it is more likely in a hospital situation. Also, spouses can feel really unimportant or like not used in a hospital setting because there's a ton of staff there and they just kind of feel like they're in the way. Whereas my midwife made sure that my husband was with me by my side, had things that were important in connecting us in the whole birthing process, which was really, really helpful for our marriage, but also like he felt like he was a part of this birth, and that was important to me. So yes. So in a hospital, I think I mentioned this, but they wake you up every 2 hours to check your vitals, check baby's vitals, make sure baby is eaten, and to rub your stomach. And this is all good. Your uterus should be contracting, but it definitely... And so if you have anything else to add to hospital birth cons, please let us know in the comments. I know it is pretty common for people to have their own experience, and I would love to hear all about that. Or maybe you have some really great things to share, and I would love to hear that too. So now we're going to go into the cons of a midwife. Okay, so there are some pretty significant cons to having a home birth midwife. They are something that you guys really have to decide as a couple and what is right for you in this situation. The first of which is the ambulance time it takes to get to a hospital in an emergency can mean the difference between life and death. And so if you do not live close to a hospital, this can be a very challenging decision to make because, you know, things go wrong, especially if it's your first, maybe even if it's not your first, you know, like crazy things happen. And so it is great to know that, you know, it takes us 4 minutes to get to the hospital from here. The other thing is you might end up paying for both a home birth with a midwife and a hospital birth. In a situation in which there is an emergency and a midwife has to bring you into the hospital, then you will also get a hospital bill, but you will also still be paying your midwife. And for some people, finances is a big deal. And I know all midwives have different contracts, and so maybe take a look at that and see what the benefits are for you not delivering with her. But most of the time they'll come with you to the hospital and be your advocate, like a doula there, but they won't really have rights depending on which state you live in. In mine they don't, and so she would just be like a doula there for me, which is also beautiful, but you could end up paying for both, which is a lot of money. The other thing is if you deliver at home, your midwife may miss your birth. And this happens more for moms that have like 5 kids and they know what's going to happen to them. So they want a midwife to be there to do a home birth, and it's beautiful and they kind of know what they're doing already, honestly. But their baby comes out so fast that the midwife isn't able to get there on time because she lives an hour or 2 hours away or whatever it is. So I know a lot of friends that has oddly happened to, and they're like, it was still great. You know, she was there when she needed to be there, but that is a thing. The other con would be you have to relocate your kids if you don't want them at your home birth, and that can be challenging for people who don't have a good support system set up around them, or just don't want their kids to stay at somebody else's house. I know people like that too, and that's perfectly okay. It just means having something set up for them, either a separate space in your own house or having someone coming over to get them, or being ready to release your husband for 30 minutes to go drop your kids off, you know, all of those different things. So that's a lot more planning, but I don't know, not that challenging. And then another con would be the pain management available for a home birth. Specifically in giving birth, there's a lot fewer options for pain management. I will say they know a lot more about different positions you can be in, which makes it a little bit more comfortable. I know they did not propose any of those things at the hospital for me, but there aren't epidurals, there isn't a lot. and I would love to hear about your guys' experiences. That's all I have for this video. I really appreciate everybody who has stuck around. This means a lot to me. It is one of my first videos I've made about all this home birth stuff, and so yes, all of it is just great, and I am praying for all of you. I hope you have a blessed birth, and it's an amazing experience, and I'm so excited for you guys to get to be there. So ciao for now. Bye guys.